Hello again and welcome back to my YouTube video series. Today I'm going to be talking to you about dissociative, that's a mouthful, identity disorder, DID, in children and teenagers, formerly known as multiple personality disorder. My name is Tracey Maxfield. I'm a nurse, author, peer specialist, and staunch stop bullying and mental health advocate and educator. And I'm doing a series of blog posts on my website www.traceymaxfield.com and videos here on YouTube to engage, educate, and empower our children and teenagers who are dealing with bullying, suicidal ideation, and have a mental illness. And so DID, Dissociative Identity Disorder. I'm sure a few people are either shrugging their shoulders or laughing right now, because for decades there has been a lot of criticism between experts that multiple personality disorder is not true. It is impossible that a person can create multiple personalities and go on living a seemingly normal life. In fact, there's been so much myth and misinformation about multiple personality disorder, mainly in TV shows and in movies. So if you think about movies where the main character had a multiple personality disorder, the most common ones we would think of and the most recent are the movies Split and Glass. And then of course we have Three Faces of Eve was another one. And so in these they're always portrayed as kind of violent, perverted, sexually aggressive, a criminal, just not a nice person. And actually that is completely untrue. The DSM-5 recently changed it from multiple personality disorder to what it really is. It is a dissociative disorder, and it is actually a very serious and very complex mental disorder or mental illness, whichever terminology you prefer to use, that it usually affects about 1% of the population, but what we are finding is more and more teenagers are now being correctly diagnosed with DID, whereas before their signs and symptoms were thought to be due to other mental disorders or ADHD, schizophrenia, bipolar disorder, depression, anxiety. What's confusing is that you can have DID, but you can also still have a significant serious depression and an anxiety disorder, and maybe still bipolar. And I know you're probably just shaking your head and going, what? Because it is very confusing. But I was asked actually by one of my followers who asked me would I consider doing an article on this, and after all the research that I've done, not only is it an extremely interesting article, but I think it's relevant for parents and just teachers, adults in general to know, because dissociative identity disorder is actually increasing in children, and many of our kids have it right now and we don't even realize it. We're just putting it down to depression, anxiety, hormone stress. So really what it is dissociation. It is usually caused by severe and significant traumatic events, and we all know what that does to the brain. It's usually severe physical, intense, extreme sexual and emotional abuse and neglect that the child is exposed to from a very early age and is ongoing. Now when you think a child, if this person is a trusted adult, there's a dilemma to begin with. The abuse may be performed with threats. If you tell someone, I'm going to leave home, I'm going to kill your mother or something. But also this is a trusted person in a child's life, and so they're trying to make sense of all this, and they know what's happening is wrong and it's dirty, but they don't want to tell anyone because they turn that fear and shame back onto themselves. So when they are being abused, what they do is they tend to go off to another place. If you think when we're having pain or when we're at the dentist office and they say, close your eyes and think of somewhere nice. You're lying on a beach, right? Warm sand, sunshine, you can hear the waves. So a child does that, but because the child has not developed the social experience and the learned skills that we as adults have, they formulate little personalities, little friends that can actually take this abuse and leave them in their mind unharmed. This is what's called disassociation. And what happens is that they develop one or more, and it is usually more, it's common to have 4 or more, very distinct personalities. For example, in 1990, a very famous study was done on teenagers, and all of these teenagers had multiple personality or dissociative identity disorder, and they wanted to determine what was when did it all begin and what was the precipitating factors. 73% of the teenagers experienced extreme physical abuse. 73% of them experienced extreme sexual abuse. 82% of them experienced extreme emotional abuse. Think ACEs, adverse childhood experiences. And so it's this abuse, which is not only of the body, but it's of the brain. And they all developed multiple personalities at the age of 4. That was the defining moment. And again, if you remember back to previous videos, that's when nurturing, love, attachment, all of that takes place. And so you can see kids who are undergoing horrendous forms of abuse, they're on a very slippery slope because it's inevitable. I'm very sad to say that they're going to develop one or more mental disorders. Dissociative identity disorder, yes, it is rare, but it is becoming more easily diagnosed. And so what they found with these teenagers was that they all had a depressed alter, they all had a scared alter, they had an angry alter, and they had a child alter. Sorry, there was a jump there. And it seems that this disassociation, whilst as a child, it enabled them to continue on with their life and feel safe and protected. If it isn't dealt with, it's going to lead to significant problems, because if a child does not learn how to cope with normal anxiety and stresses and pain and anger and identify what that is, and they rely on disassociation, then they're never going to develop completely as a child, go into teenage years, and so this multiple personality will continue on throughout their life, and it will be significant problems, not only in school but also in the workplace, in any kind of relationship or friendship that they want to develop. And so the dissociative identity disorder, your child is going to present with periods of amnesia, spacing out, total periods of forgetfulness. Oh, where am I? Where was I? What am I doing here? They'll forget personal information like a name, age, address, right? Things like that. And you're like, what? How weird is that? They will have unexpected outbursts of anger and violence completely from nowhere. Depending on the alter that comes up at that time, fear, anxiety. Also, you're going to have a child presenting with a dissociative identity disorder that has like non-epileptic seizures. It's just, something's not right. They're just staring at the TV. They also will have not one imaginary friend. Now, we know all kids have imaginary friends, but they have lots of imaginary friends, and those imaginary friends are very real to them and can be described in great detail. And these alters or personalities will be very different. They can be of a different race, they can be of a different sex, they can be from a different culture, they can be of a different age. They will like different food. They like different activities. They'll wear their hair differently. They'll wear makeup differently. They'll have different clothes. And so as you can imagine, you'd be looking at your child or teenager going, okay, what's going on? One minute he was dressed like this, now he's dressed like that. And yet, to the child or teenager, this is absolutely normal, and they're not understanding why you're reacting like that. Also, they will vehemently deny doing anything, say bad behavior or caught doing something. And then when you sit down and say to them, okay, time out, you did this, they will vehemently deny it because they don't have any memory. And then they will start blaming their imaginary friends. And usually when there is inappropriate conduct or behaviors or outbursts, they will blame the imaginary friend. It seems all the imaginary friends will be responsible for the out of the normal realm of behavior. And I think most of you are probably thinking, okay, so how do I know which one is my real child? They will present more often than not with the alters, but again, it's going to be very confusing and overwhelming. And I don't envy any parents, guardians, friends, families that have to deal with this, because it does require intensive therapy, and it's long-term therapy, because the therapist has to individualize every single personality, track it back to the trauma, and then work forward. With teenagers who have dissociative identity disorder, what you're going to find is that they will have more frequent non-epileptic seizures. They will have way more frequent periods of amnesia, like honest amnesia. And, say for example, you get in the car and you go to the mall, and then you get to the mall, and then he suddenly says, well, what am I doing here? Why am I at the mall? But all in the car, a normal conversation had been going on, and that's difficult to kind of get your brain around, if you understand what I mean. They also, it says, another sign and symptom is sexual dysfunction. Now, as parents, unless you have a child that's actually a teenager that's actually talking to you about that, that may be a difficult one to pinpoint. But it's anger outbursts as well, and because they will all have an anger, the focus of their anger alter, that kind of sticks up and defends all of them against the horrors that happened, because deep down only one alter will know what happened. You're getting what I'm talking about. Now, treatment, as I said, is very, very long. There will be a need for individual therapy, which will comprise of play therapy, especially if it's a child, art therapy. These are expression therapies, and sometimes the child or teenager is much able to express through written word, poetry, drawings, art, cartoons, doodling. Talk therapy. What we're also finding is hypnosis is very helpful, especially in identifying the alters. And EMDR, eye movement desensitization and reprocessing, has recently been tried and found to be very, very successful. So that's really great. Now, the challenge with all of these therapies, and what you as parents need to know, is that they have to go back to the root cause. So it's going to be actually very traumatic and very painful, not only for the child or teenager to relive this, and I understand it, but also for the parents and the family members to see this. therapy needs to be a joint effort. It has to be a committed family effort. And, to all the parents out there that may have a child or teenager diagnosed with this, I think what you need to look at as well is that if one of the alters is depressed, then the depression does have to be treated, because it is very serious. Similarly, if they have an anxiety disorder, also, it's not unusual for children and teenagers, especially teenagers with an identity disorder, to resort to risky behaviors, criminal activities, and alcohol and drug abuse. And I think it's that need that you need to also promote their safety and security. That is absolutely necessary. As a parent, what I would urge you is to find out as much information as possible. Join a support group or an online group, of which there are now many. Talk to your mental health professional and get as much information as you can, and then work with your child or teenager in the therapy. As a parent, it's easy to say, but you really need to stay calm and focus on the long-term outcomes. You've got to completely validate and understand and show love and compassion to your child or teenager and be there for them to help them. I think it's important that you notify the school and work with the school, because I'm sure they've seen the alters, and so this is not a time of ridicule. This is very serious, and so they need to understand that. Also remember, if your child or teenager's alters, high likelihood that they could be a victim of a bully. So again, you need to consider all these things. As always, there's always more detail, which is actually in the blog post on my website. But I hope that you found this interesting and a little helpful, because as I said, it is being diagnosed more frequently. I do know of a child as young as 4 that has been diagnosed with it, and most recently a teenager who had suffered with depression for many years was finally actually diagnosed with having a dissociative identity disorder, of which 2 alters. One was a depressed and one was very suicidal, and treatment and counseling was needed as well for those alters, but therapy has helped to move them forward. So there is a very positive outcome for children and teenagers who are diagnosed early and treatment is started as quickly as possible and followed through. They have a much better success rate than adults with a dissociative identity disorder. Thank you for your time.